Yo, what's really good on my day one? Welcome back to the channel. Here we have with me my really good buddy Eli. So it was a pleasure getting to know him during this deployment, and this is a very special episode because he has something that I don't, and that's like teaching experience. I don't want to teach just yet. He has a very interesting background, and I wanted him to talk about it and also basically give you tips on how to pass CCATT without giving out too much, but at the same time like discuss like his whole process and what the process is of getting into CCATT. So
what's going on?
yeah, introduce yourself, go from here, talk about like your nursing background, how you went into the Air Force.
My name's Eli. I've been an ER nurse for about 8 years now. Started my career at a trauma center in the South, just cutting my teeth on penetrating trauma, and really had a great foundation for emergency medicine. And then decided, I'd gained a lot of really valuable experience. I wanted to serve the country. Some really cool military medics came through rotations at my hospital I was working at, and that kind of led me to understanding all the opportunities that are in the Air Force for nursing. So for me, it was like a no-brainer. Then I joined ER nurse for a couple of years in the Air Force, and then got picked up for a CCATT role, and a couple of deployments later, now an instructor.
Did you always know you wanted to become a CCATT instructor?
Yeah, actually, after my first deployment, I decided that that's what I wanted to do. I love the operational impact that CCATT has. That's really kind of what drove me to the Air Force. Was wanted to care for wounded warriors, and CCATT gives you a really great opportunity to do that.
Talk about like the whole CCATT mission, what we exactly do, because I know a lot of people like are interested in CCATT, right? And I think the misconception is like ER nurses don't make good CCATT, and like I think it's the biggest thing that you hear. But like there are excellent CCATT ER nurses out there. So
yeah, they are. I'm not one of them, but they exist. No, ER is a really fun foundation for CCATT because of the just lack of predictability on a mission and the ability to think on your feet. I'd say you're in a pretty resource constrained environment, and people who are used to solving problems in the ER bring that valuable flexibility. As well as, where I came from, we had 7 or 8 ICUs always backing up to the ER. So while maybe I didn't have the highest detailed level of critical care knowledge coming in, I had quite a bit of breadth and generalization caring for different critical care patients, as well as the trauma, which is a big focus of CCATT.
I know that you're teaching now, and we're not going to say exactly where. If you do end up going through CCATT, like you go through initial, and he is one of the instructors. I'm not going to tell you exactly what part of the whole CCATT, pipeline, but from an instructor's perspective, what would someone need, or what kind of personnel are we looking for to grow within that CCATT realm?
Yeah, that's a great question. I think it comes down to when you're flying. I would just keep this as like what makes a successful CCATT nurse in general.
Yeah.
Because if we're doing our job right at the schoolhouse, that's what we're looking for. Think of it like you're kind of on an island in the sky in a way. You have very limited to no backup, so a nurse specifically has to be extremely comfortable with all the medications, has to be a subject matter expert, being able to safely mix medications, administer on a schedule. There's very limited resources up at altitude, no Wi-Fi, no big safety systems that you may work on with the hospital. A lot of it's just pen and paper, you and the doc kind of talking through the plan. So you need to understand how to safely administer all the meds, mix them yourself, know your correct dosages, and maybe have some downloaded offline resources. But essentially being a subject matter expert with all things related to critical care nursing.
You see a lot of students.
Sure.
Talk about what causes failure, but also what causes, or what do you need to do to pass?
We have kind of 2 things we look at. We look at your technical proficiency, and that's some of the things I mentioned, like critical care knowledge, foundations, medication safety with all the equipment. Essentially, the name of the game is like keeping the patients alive and unharmed. And en route with a lot of movement, limited resources, it can actually be a pretty big challenge to ensure your patient is safe, receiving standard of care. So there's an extremely heavy technical piece where you have to understand how to use your equipment. You have to be proficient with especially all the medication delivery devices, being just overall a safe nurse. But then there's also an element of what we call non-technical skills. That's more of like your interpersonal skills. I think like you're on a three-man team, and everybody has to be on the same page, understanding the critical goals of care. And that can be a dynamic thing where maybe priorities are shifting and changing, and you need to be a good team player, able to communicate, making sure everybody has an updated mental model, and everybody's on the same page. So like your teamwork skills, your communication, being able to integrate information as it's changing. And I think that goes down to critical care experience, being able to understand patterns, anticipate patients' needs, being able to, as a team, understand like what's my most proximal life threat, what's my most critical goal, and be able to intervene on those in an appropriate manner, racking and stacking your priorities, and not getting lost in the sauce, which can happen when you are task saturated, when there's environmental stimuli that are overwhelming at times.
Yeah, and I say this from my experience at least, is they will throw you in situations that you are super uncomfortable with, and the fact that like two chaotic things are happening at the same time, you need to be able to do that. Have you seen someone go through the program? In the beginning they were terrible, but by the end they were performing at the standard of a CCATT.
Yeah, we kind of crawl, walk, run with our program. It is a new environment for most people, a lot of stressors, and it's certainly a situation where we want to see progress. One bad simulation isn't going to make or break you. We certainly look for progress and getting more comfortable with the environment.
And I say this from my perspective. I have so much like ICU experience that like for me it was a little bit easier. I was just more hypercritical about like the little things. Like I got hyperfixated on like the B-bron
Sure.
or the IVAC, and that's what you zoom in on. And those are the things that you need to learn from, because once you get kind of like zoomed in on something, it retracts you from all the other chaotic things happening around you. And they want to be able to know that you could juggle more than 3 things at one time. In a sense that like when the doctor's backed up, you need to be able to make these decisions that like you're uncomfortable with, and they want to see that. Going forward with CCATT, what do you think it could do for your career? Like going forward, like what do you plan on doing, at least with your CCATT experience?
Yeah, great. That's a great question. I think CCATT, especially, if you're stuck in like a military or hospital for the majority of your career, CCATT really broadens your horizons, gives you the opportunity to network and maybe work on some joint assignments, see how different branches approach patient care. Just learn more operational knowledge. You're hanging out with air crew. You're part of logistics planning, logistics decisions, understanding kind of how the sausage is made. So really opened your eyes to more operational considerations in the Air Force. And for me, I love that. I love being a part of that. You meet very interesting people. Networking is great. And then also, like if you're a CCATT nurse in the Air Force, that means that you've been through some rigorous training, and it's well respected on the resume. People understand that you know what you're talking about as far as critical care goes. So that can open up opportunities for further education, things like that.
When you guys accept applicants, right, is it at your level, or is it more on the squadron level where we're coming from?
Yeah, it's above our heads.
Give me an idea of like how many students you guys are processing per annual.
Well, I don't want to get into the specifics there with,
Yeah.
just
a ballpark number of how many like you produce, like how many nurses you think.
Well, it depends on the needs of the Air Force, how many CCATT nurses they're wanting to push through and push out. So it can kind of vary year to year, but everybody comes through CCATT every 3 years to maintain their skills. So it's kind of hard to parse out who all is like new to the program versus who is coming back for a revalidation.
Yeah, and that's the thing too. Going forward with the Air Force, with our new SecDef, like they're increasing a lot more on like wartime. The fact that they're increasing these numbers, we don't even know how much they want, valid during these war times. So it's like hit or miss per unit, I guess. Even for us, like we're continuously trying to produce more CCATT where I'm from. My understanding is we're pretty low in the numbers. Not low. Like we have CCATT numbers. It's just they want to produce more.
And I'll say on that CCATT brings a really unique piece to the patient movement problem, and the Air Force CCATT program is recognized across the DoD as an excellent program. We've had a lot of great, the strength is obviously the people who come through, and I say CCATT has a solid reputation across the total force.
Yeah.
And many people want CCATT to be part of their medical contingency planning.
It just looks so good. Like all my buddies, whether they stayed or whether they, what's Steven doing? Whether they stayed or whether they ended up leaving, they ended up going back to school. But it's opened up tremendous doors. Like for you, I know we had this discussion. I didn't go more into it because I knew we were going to have this interview. Do you plan on going? You plan on staying? Do you plan on going? What do you plan on doing with the CCATT experience that you've garnered?
It'll be hard to walk away from. Just once you're getting to do the mission and actually taking care of the wounded warriors, that's been the highlight of my career. So I'd like to stay involved at some level of that patient movement piece. As far as further education, that you can really take advantage of opportunities that the Air Force provides. So exploring those options, as well as just trying to stay operational, trying to really touch that patient movement piece of the mission. CCATT's a good first step to getting into kind of that network.
Yeah, and I think it's awesome because like what it's done for a lot of people's careers, whether going back for NP, CRNA, the fact that you have that CCATT identifier, even on the civilian side, it's just a very good accolade to have. Because I've spoken with one of my buddies who did interview for CRNA on the outside, and they were just like, tell us more about what you've done.
Yeah.
So at that point they're interviewing you, which is pretty awesome because like now you're telling them like kind of the things that you've done. And I failed to mention this, you will be practicing outside of your scope as a nurse because you are doing some pretty advanced things. The more that when they are interviewing you, you're telling these things, they're interested to know. For the most part, everyone who's applied to like CRNA school, NP school on the outside, PA school, whatever, they all got in.
Say you're practicing within the scope, but it's just underneath the supervision of the physician.
Of the physician.
You may be relied on more heavily than what your practice might be in a civilian institution.
Let me retract my statement. You practice within the scope of the doctor. Of course, you clarify your orders, but like just be prepared to be uncomfortable in certain situations.
But I think that's a good point. Something I kind of want to talk about is think of you're on a 3-man team. I'm a human. I make mistakes. I can assume the same thing for my teammates. You might need to back each other up. Yes. So a CCATT nurse isn't just going to be a task rabbit knocking out all the tasks that the doctor says to do. The CCATT nurse needs to be able to assist with that shared decision making, needs to be able to contribute with good critical thinking and good critical care knowledge base to help kind of back up the physician. If you have competing priorities, multiple patients, you don't need to be just nagging the doctor for every little thing. You need to be able to be making good critical decisions. And then as far as like respiratory care, say you have 2 or 3 intubated patients on ventilators, and they may need some help doing vent setup or vent titrations. The CCATT nurse is expected to understand how to safely put somebody on mechanical ventilation, understand ventilator modes and whatever piece of that ventilator is doing. So it's a little bit more of an expanded reliance on the CCATT nurse than in the traditional hospital.
Yeah, so you need to learn to anticipate. So that's the biggest thing is like if you're a brand new ICU nurse, ER nurse, and you still haven't gotten down like the nitty gritty of like your job, and you're still stumbling on like little things. What medication should I start? You might want to consider having a little bit more experience coming in before like applying to the CCATT experience, because like you talk about medications, right?
Yeah.
And I think that's the most important part is like you don't want to be starting dobutamine on a patient who had their leg blown off, whereas like you have like epi or something else. So those are the little things that you need to kind of askew on, and like you learn that through like bedside and also traumatic experiences. For someone who wants to come in, give them something, give them something inspirational for someone who's trying to come into our positions. Being
able to take care of the warfighter is an absolute honor, and I think I mentioned this earlier, it's the highlight of my career. It's the coolest thing I've been able to do as a nurse, period. You have guys and gals putting themselves at risk downrange, and being a part of that equation to get them home to their families safely. We've had a lot of CCATT transfers over the years where patients were maybe looking really critical, might not make it, but that CCATT piece is able to get them home and get them recovered to see their families and to go on and live meaningful lives with reasonable quality of life. And I think that's just something you can't quantify. Is if you get the opportunity to be part of something like that, it's just truly humbling and an honor.
Thank you, Eli. Appreciate you.
Thanks, Jim.
You ever run into this guy? Like, you probably saw this video, but for the most part, I was telling him that a lot of people who not a lot, the people who I've interviewed, like the ICU, the CRNAs, they've already ran into these people. So, like, if you ever see him, say hi, tell him you've seen my video.
He's a popular guy.
Not really.
Genesis.
But I just like to help people as well. He likes to help people.
Yeah.
If you want to succeed as bad as you want to breathe, he's there to help you as well. So appreciate you, dude.
Yeah, gotta stay hungry.
Thank you.
Yeah.
We're wrapping up this deployment, and I wanted to get his insight, and I hope this helps your insight, and hope to see you guys, hopefully, in the CCATT world.
Yeah. Thanks for having me.
Yeah, for sure. Appreciate you, dude.
Yeah, bro.
Hey,
That was a good one.
That was a good one.
I like it.
All right, cool. Thanks.